Hey, congratulations, you've made it to the other side of the vasectomy. So at this point, you are in the vasectomy recovery process. Quick video here just to go over what to expect over the next few days. First question is, should I ice my scrotum? Yes, you should. 15 minutes on, 15 to 30 minutes on and off for the first day. Don't put the ice pack directly on the skin, so put like a little towel on there. Put the ice pack on top, kind of on and off to keep the inflammation down. Do this in combination with scrotal support. So you can either roll up some towels underneath it, use the jock straps that we give you. Just keep things as elevated and as ice for the first day, even the first 2 days, and that will really help out with your recovery. When can I return to strenuous activity? 7 days is my recommendation. The reason for this is that you can develop severe scrotal swelling. Swelling is difficult to resolve when it's in the scrotum because it's such a dependent area. Therefore, 7 days is the best period of time to allow for to make sure that there's no edema will build up. Main question that most guys ask is, when can I return back to intercourse? My recommendation is 7 days. There may be some pain with the first ejaculation that will resolve. And we like to wait 7 days is because the vas tubes were just closed, and we want to prevent any sort of reason for those tubes to try to vermiculate or peristall sperm back through. And so I think this will, for one, decrease pain, and two, make sure that the vasectomy procedure is a success. What kind of diet can I have afterwards? You can have any sort of diet that you want. If you take a blood thinner, aspirin, Plavix, warfarin, etc., we will advise that you consult with us before returning those medications, but there are no dietary restrictions. What should I do for pain? Our best recommendation is to stay on scheduled Tylenol. If Tylenol does not resolve the pain, then you can add additional ibuprofen on top of the Tylenol on a 1 to 2 time use basis to make sure that your pain is well controlled. If your pain is not controlled past Tylenol and ibuprofen, then recommend that you call the clinic and we can help you walk you through some of the next steps. How do I take care of the incision? The incision will have a stitch underneath the skin, and then sometimes there's actually glue on top. Don't soak the incision for the first 3 to 4 days, but you can take a shower and let water run over it. Why should I call the clinic? Reasons to call the clinic are most people tolerate this procedure just fine and have no complications afterwards. Reasons to call the clinic are if you're having fevers after the procedure, if you're having severe redness of the scrotum, if you're having severe redness and pain in the scrotum to indicate an infection. After the procedure, there may be some bruising. There may be what's called a sperm granuloma that develops at the site of the vasectomy. There may be that would feel like small knots adjacent to the vasectomy area, and there would just be some generalized edema. So if you feel like you have an infection, meaning fevers and severe swelling and pain, that would be a reason to call the clinic, and we would start you on an antibiotic. The follow-up plan, most men do not have to come back into clinic for a wound check after vasectomy. However, if you feel as though there's an issue, feel free to call and arrange that. But the follow-up will consist of the semen analysis, which would be at 3 months. On discharge, we will give you a cup. You will use that cup to collect the semen, and then there will also be instructions on how to bring that specimen to the sperm bank for analysis. That's all I got. Wish you the best of luck on your recovery, and we are absolutely here for you if you have any questions. Thanks.